If you've got back pain and knee pain and you're terrified of squatting because of bad knees or a bad back, here are my quickest exercises to get you from this to this. And in today's video, we're going to go over the most common issues that contribute to painful knees and a painful back, as well as my favorite exercises to progress you all the way to functional lifting and my 5 big functional movement patterns. Because the best lift is not always a squat. There are lots of different functional movement patterns that you can use to get the job done. And when you use the tools of your body correctly, you're able to preserve your body and live a much more healthy, much more functional life. Hey, I'm Dr. Nick. I'm a doctor of physical therapy and functional movement therapist. And today I want to show you how to use the tools of your body so that you can live without pain and preserve the joints of your body without arthritic changes. Now, when you have painful knees when you're squatting, the issue typically isn't your knees. It's the weight shift into your knees. And most of us, as we're leaning forward to pick up the item off the floor, off the counter, whatever it may be, we shift forward into our forefoot and put excessive pressure into the front of the knee joint. We often do that by rounding the spine as well as we lean forward. And then most often that knee caves in ever so lightly. And what that does is puts an excessive amount of compression on the inside knee joint. And that's where most people, 9 out of 10 people, tend to break down. So with knee arthritis, most of the time, it's the medial compartment of the knee that tends to have pain. And what we want to do are a couple things. Number one, we're going to regain mobility. I'm going to show you how to do that here quickly and effectively. Then we want to improve the strength of your quads, glutes, and core. These are the muscles of the triangles of stability in the FMT 360 method. And then we're going to show you how to load those areas into functional movement patterns. So here we go. So with arthritic changes in the knee, most often we're going to be lacking a little bit of knee extension. So we're not going to be able to get that leg fully straight. And what you want to do is to support that with some just gentle static stretching. If you're unable to push the knee down straight or have pain with that, I suggest putting a towel roll, or even a pillow underneath the knee to make it comfortable at rest. Then we're going to do the next 2 stretches. And when performing your stretches, you want a strap that does not stretch. A lot of people mistake a stretching band with a stretch-e band. And we actually don't want that band to stretch. We want to have something nice and tense. A dog leash. This is called a yoga stretch strap. Runs about $5 on Amazon. I'll drop a link in the description below just so you can have easy access to that. But all we're going to do here, and you can do this lying down or sitting up, it's up to you. Again, put that towel roll under to make it comfortable, but we're just going to pull back on the toes, get a little bit of a calf stretch. We want to stretch that calf because it comes across the hamstring. We're going to hold that for 20 to 30 seconds. We're going to do a few of them, okay? So stretch, hold, rest in between, and then stretch again. I know nobody likes to rest. We like to hold that stretch and think that holding it forever is going to do just the same amount as doing sets, but that's not quite true. So give yourself a little bit of rest in between. You'll notice a difference in your flexibility. Then we're going to jump into our hamstring stretch. So we'll lay on our back, opposite knee bent. This is going to protect our spine here. And then we're going to lift that leg all the way up. Feel free to choke up on the bat. And at this position, one of the little tricks here, engage your quad to push through. So engage your top thigh muscle to straighten that knee up. And that'll really get a good stretch right behind the knee joint because that hamstring runs from just about the top of the calf up to the lower back there. Again, 20 to 30 second holds. We're going to do 2 to 3 of them and see where we're at there. Breathe, rest, relax, stretch it out. We can then work into some gentle heel slides from this position. So what we'll do is we're going to go ahead and use both hands to help our knee up and come to the point of stretch here, not to pain. You may need a few repetitions here to improve the joint mobility and your range of motion, okay? And if the strap feels like it's going to slip off your heel, go ahead and crisscross that strap into an X right around the foot, and it comes right around the knee, and it really keeps the ankle, the knee, and the hip in good alignment so that we can get that full range of motion. And what you're looking for is to bring that foot all the way to bent, foot flat, where it is exactly the same amount as the opposite knee. That doesn't hurt. if you have two non-painful knees. If you have two painful knees, go ahead and do these on both sides, right? Now, for some of the hip and core testing, I've got those in other videos here, so check that out next if you're not sure if you have enough strength to squat. So those are non-weight bearing ways that we can build up to these functional movements, and I want to make sure that you're set up for success. So next we want to start to load those knees functionally, and I suggest a little bit of support. If you have a countertop, a sink, or here in the gym we've got our squat rack here, I'm going to bring my feet about shoulder width apart here, and I want to sit back into my hips and heels. Remember that when we load forwards and our feet cave in and our knees cave in, that's when we can get that inside knee joint pain. But if we sit back into our hips and heels and come through that area, now I can get much, much deeper. And then I'm swinging those hips under just until that point of stretch. And whether you have one hand support, two hand support, the support and strength part isn't here. It's really just about mobility. Can I start to sit in through that pain-free range so that I can open up that range of motion? And what you're doing is you're desensitizing that joint, improving the joint lubrication. And that's really, really important to get the synovial fluid moving into the knees and into those hips, right? Because those hips haven't gotten that deep in a while either. And then just improving the oxygenation and blood flow to those tissues. So important for healing there that we stay in that pain-free range. So remember, guys, no pain, all gain as we go here. Give yourself the time to perform your repetitions. And then at the top of the movement, so I'm coming into depth, right? At the top of the movement, I'm driving through my heels, engaging my quads and engaging my glutes. Back into depth, driving up, squeezing those thighs and hips, okay? And just go through a few sets of those. I would suggest a couple sets of 5 to 10 repetitions there, and just allow that to open up with time so that we can be ready for our next step. Next step we're gonna do is use a standard chair. Anytime you get into and out of a chair, it is a squat. So anybody who ever tells me, I don't squat, I can't squat, I know that's a fib because you just got off the toilet a little bit ago, right? We can all squat. It's a matter of how well. So we're going to use our quads, we're going to use our glutes, we're going to use our core. And here's where most people break down, okay? So as I mentioned, the feet fall in, the knees fall in, the lower back caves. So we're going to go away from that. I want you to start at the feet and thinking about opening up your feet, just rolling out. We're going to have our weight through the ball of the foot, the outside of the fifth, the center of the heel. Then we're going to roll out from our hips and pelvis. So think about opening up the hips to engage those glutes and then engaging your deep abdominal muscles. So creating that wide, flat abdomen of the TA. I've got tons of videos on that. It's such an important piece of the puzzle. Again, not getting hit in the gut here, creating a wide, flat abdomen so you can maintain breath. So feet, hips, core engaged here. And this guy isn't big. We're not trying to lift weights here. This is called a goblet box squat. So what we're going to do, this is going to be a counterbalance for us. I just want you to hold it. If you have a kettlebell, great. Hook those thumbs right under the bell position. If you just have like a half gallon of water or some big water jugs or a couple cans of soup, that could be fine as well using a standard chair. You don't need anything fancy here. So we're going to open those feet, engage those hips, engage that core, keep our kettlebell or weight right in front of us, and sit my hips backwards, not letting that knee shift or shimmy as I go back or as I come up into a squat. So just to show you kind of sideways here, as I sit back, you'll notice that the angle between my torso, so ears to hips, and heels to knees are parallel. And that's what we're looking for, right? We don't want to lose it and cave in here. That's when things break down. And as you progress, you can go into simply touching and then rising. You can go into a deeper position, so maybe lowering that chair, or coming away from the seat altogether and working into depth. Remember to give yourself time to progress into those motions. This normally takes people somewhere between 2 to 6 weeks, depending on the severity of the knee pain and the back pain, but it really is helpful over time to stay under your threshold and progress as you tolerate. And you'll notice that when we are ready to load the movements and work into our strength training, changing the position of the load really challenges you in some very different ways. You'll notice that sometimes I have to carry something maybe on the side, maybe I'm picking up a bag and I just have to work into like lifting that on one side. I don't always hold it right in front of me, right on the middle, but even changing the hand position like so really changes the way that our muscles work together. So continue to be novel about the way that you challenge yourself in your functional workouts. And personally, I do find that the barbell squat and back squat are one of the tougher positions. When we have weight in front of us, even if it's off to the side, it just tends to be a little more counterbalancing as we sit back into that deep squat. However, putting it on our back really challenges the posterior chain, and most people tend to be a little bit weak there, so just know that as you progress, going from unloaded to light load with support, to light load without support, to heavier load without support, is kind of the progression that we're going to take here. And again, this is going to happen over time, but have fun. And I think it's okay to have fun when you're doing your workouts. You might as well enjoy it. It's good for you, but we need to enjoy it. This is a yoga ball or a physio ball. It runs somewhere between $15 and $25, depending on where you get it from. You can always spend more on things. But what we're going to do, and I believe this is about a 45 centimeter physio ball. There's not particularly any right or wrong. They all work, especially for this purpose. But if this is the first time for you, make sure that you have a little bit of support here, just something to hold on to just in case. We're going to bring our feet further forward than you think. It's a good 18 to 24 inches in front of the ball here. Feet shoulder width apart, so I'm really actually leaning back on the ball. You see I have a pretty good angle. Again, we're going to find that good plantedness of the foot, open the hips and engage those glutes, set our core. Similar process to what we did before with the goblet box squat. And then we're going to sit into those hips. So as we come down, ears, shoulders, hips are in line. I'm creating those nice 90-degree angles. I don't necessarily need to go super deep into that. I want to be controlled. So working into depth, and by pushing back into the ball, setting my core, really engaging my hips there. So instead of letting the knees cave, even if it's light here, imagine pushing out from the hips so you can rotate those hips out to sit into depth, control. And again, when we are ready to load, we can do that using our kettlebells, dumbbells, squeezing through those quads and glutes. Stick training is a great way to help yourself maintain a neutral spine as you're working into your hip hinging and functional movement patterns. So this doesn't have to weigh anything at all, right? It could be a broom handle or a Swiffer handle. This is just a simple PVC pipe. And what we're going to do is place it behind the back. We want it to touch the base of our head, our mid-spine, and our tailbone as we work into our squat. And just like the step before, if we need a chair behind us or something to help us to move into that pattern, absolutely fine. Not a problem at all. We want to be safe. We want to be successful. We want to be pain-free. So let those parameters lead the way of any type of ego that might be here. And then continue to emphasize your muscle activation as we go into these movements. So again, chest up, eyes up, hips go back, feet out, and finding that planted position, and then sitting into those hips. And then working through your comfortable depth. And we'll get used to sitting into our hips and heels. So I really hope you enjoyed those demonstrations of how to get back to squatting to alleviate back pain and knee pain. There are 4 other big functional movements that I want to teach here, but they're going to be in future videos. Learning how to deadlift, how to lunge, how to perform a split stance deadlift, and a single leg RDL, which are all essential parts of function and being able to live well so that we're not wearing out our joints and we can live well into our late years without pain. So if you haven't joined and subscribed to the channel, go ahead and do that so I can get you more free content and show you how to live that functional life. Until then, thank you so much for watching. I appreciate all of you guys. Have a blessed day.